Thanks for joining us for the second half. We call this Next Up, where we interview community leaders. And this half hour, Ray and I are privileged to talk to three outstanding individuals. We're going to take a look at gun violence and gunshot wounds. Unfortunately, a topic that's way too relevant in the greater St. Louis area. In the city of St. Louis last year, there were 200 homicides. I don't know how many shootings. We do know that 120 kids under 17 were shot last year in our region. 26 of them died. And there's a great program called Life Outside Violence that's intended to break that cycle of violence. And we're joined by three individuals who know something about that. Doug Schuerer is with us today. He's a trauma surgeon at BJC. We're also joined by Kateri Chapman-Kramer, project coordinator with Life Outside Violence, and Darren Seals, community outreach rep, who's also joining us on this panel. And Dr. Schuerer, I guess we'll start with you. Okay. This is the leading cause of death for children, is it not? Gun violence.
Firearms are the leading cause of death, yes. Absolutely. It's for the first time last year, it crossed the border over top of car accidents. So.
Well, that's pretty grim. And personally, you are now at BJC with other hospitals, combining forces with universities to try and do something about that. It's called Life Outside Violence.
Yes, we felt the need to have a hospital-based violence intervention program. We also realized that the number of children's hospitals and adult hospitals in our region, that if we didn't follow with each other, we wouldn't really know if our programs were effective at preventing future violence. So we got together with the other trauma centers, both adult and children in the city, to work at making a citywide program, actually the first citywide hospital-based violence intervention program in the country.
The first one in the country.
Kateri and Darren, tell us how you got into this very important work at Life Outside of Violence.
Yeah, I think really where it started was physicians that were treating patients realize we are fed up with seeing a lot of the same individuals come in with violent injury. And so it really started kind of at the top down from hospital administrators and other partners. So this includes physicians, leadership, social workers, nursing staff, and then down to the level of our program intervention piece, but to say we needed to do something to address this and be able to track, you know, who are coming in for repeat injury and what do we do about it. So while the hospital treats the medical piece and then participants go back home, they're still living in those same environments and spaces, right? And so our program follows them after hospital discharge. So the design was to have someone reach them immediately at bedside in the hospital after injury, be able to connect with them, which is what the outreach team does, and say, I've been there. So that outreach team has lived experience, so either been a victim themselves or has family members that have been impacted, and then connect them to clinical staff that can follow up with them for around about a year, providing counseling and case management to address not only the injury, but all of the other trauma in life that comes up that have led up to that injury.
Darren Seals, what specifically do you do?
I'm an outreach activist. So what I do is once the kid gets shot, I go straight to the hospital. I think we got 45 minutes to try to change the norm, talk to them, and lead them in a different direction. I got involved with Life Outside of Violence through Kateri watching me work in the community. And she kept trying to say, we got a program coming, we've worked some things out. And I was like, let's work, because it's about to work with me. So all the kids I encounter with, you know, we look at love, L-O-V-E. They look at love, T-I-M-E. So I started noticing that you got to spend a lot of time with them. So I try to do a tough mentoring program, let them know, you know, I've been shot 13 times.
You've been shot 13 times?
Yeah. So I lived that life, ripped and ran the streets, so I turned my life over to the Lord. And I was trying to get out of St. Louis, and he led me back to just come do the work. So I'm giving back. I was part of the destruction, and now I'm part of the construction. So.
Well, that's pretty profound. I didn't expect that comment. A lot of times people, when we think of gunshot victim, we're thinking of them as the victim, and of course they are. What can you do? I mean, Are you talking to people who, as you mentioned, are part of the destruction, or sometimes are they just random victims, I mean, of violence?
I try to tackle all of them. Anybody that need help. And like, most of the time it's like, what, 13 through 21. Mind confused, and I try to change the norm for them, let them know it is a way out. If you really look back at how, when we was little, we had a lot of things to do. These little kids has nothing to do. So they think it's cool to jump in a car and joyride and hit somebody until they have to come see him. Then it's serious. So I always tell a little kid, you have to be able to see it. And I always tell them, you know, we don't have a drug problem in St. Louis. We don't have a dope problem. We have a man problem. You know, men have to step up and start raising the village and start giving back. You know, like, if you say to be a man, you got to see a man. So every day, like, everybody at this table probably saw their father in the household. These little kids don't have fathers in the household. So the structure. So with Life Outside of Violence, we break it all the way down. We go to the beginning to the end. Try not to miss a beat. I have kids that probably meet 7 o'clock in the evening. I'm lost. Okay, I'll call you tomorrow. No, they want to talk right there. So that conversation has to be met right there. So try to change the norm for them.
Dr. Schuerer, how many gunshot wounds do you see on a daily basis?
Probably better to go on a yearly basis because certainly day-to-day is different. Weekends tend to be a little busier. We peaked in 2020 up to about 150 visits to our emergency room for gunshot wounds in the single year. So yeah, it's more than 2 a day for sure. Some days it's 4 or 5. Some days obviously not as many. But we are still around 800 this year. So it's interesting. We've seen peaks with episodes of violence or the COVID. And unfortunately, whenever there's a peak, it doesn't usually come back down much. It stays up at a higher new level and new plateau.
Is it fair to say the homicide numbers would be higher if not for the trauma surgeons who are saving lives?
I guess we'd like to say that for sure, but that's what we're there for as trauma surgeons, to take care of things. But if you come in with a gunshot wound and you come in alive, 95% of the time you're going to leave the hospital alive.
You know, the thing is, we look at homicides, but we don't often think of the people who survive the gunshots. And that's the group that you're dealing with. But that person might be in a wheelchair for the rest of his or her life, or maybe mentally impaired, or the right arm doesn't work anymore, or walks with a limp. We don't think about that in the media, that those who survive, we think, oh, they're lucky. Well, they're lucky to an extent, except that their lives are immeasurably changed for here on out.
Yeah, and I do want to highlight, so gun violence is one piece of this, but the other piece that is included in Life Outside of Violence is we know there's a progression. You may come in for a blunt assault at one point in time. Without intervention, that can increase to a stabbing, then ultimately gun violence. So we treat all of those patients, even starting with blunt trauma. And it does have to be holistic, and it does have to be upstream. So part of our intervention is including education, connection to employment opportunities. Because yeah, like you're saying, we have patients that come in that were working and life was going well as far as they knew, but you can't do that if you have a significant injury moving forward from that. So it's really I would say a wraparound or a holistic approach. So not just treating kind of the mental health components that come up from the injury or the trauma leading up to it, but all of these other pieces that we all deserve to have as well-being and functions of daily living.
Can I just add, in terms of the trauma and, as you mentioned, the disabilities that come with gun violence, the real problem with this disease and trauma in general is it usually acts on a younger age. It's these are younger people. Not that cancer and heart disease aren't very important, because they are, but the number of life years lost, the cost is for a shorter period of time when you're 20 as opposed to 60.
Sure.
So it hurts them for their entire life, and it puts something on society as well.
There is no more politicized topic in our world than guns. We were talking about it earlier. There's an issue in Illinois. There's always an issue. How do you obviously are talking about dealing with the source. You're trying to get at it from a cause standpoint. how much does gun policy come in to affect what you do, and what, without dragging you into the political discussion, what are your thoughts about that?
Well, that's a big question. So I know that we are very mindful to not get into that debate. We
And
know,
I'm not suggesting you
yeah,
should.
we know where Missouri
Right.
sits in terms of that conversation, and so I think we're just doing our best as a team to treat, prevent. So if it's bringing young people into our program or any other programs in the region, that's really where we sit. There's not much else I think that we can do on that piece of it, but it's certainly something that we are aware of and discuss.
So trauma surgeons, we have all across the board are trauma surgeons, but we all agree that we want less bullet holes and less people. And so there are some things that most people agree on all spectrums. Safe guns, safe locks at home, you know, trying to make sure that people get guns that are supposed to have guns and not the ones otherwise. And those are agreed upon across the board. Those aren't things that are really too much argued, and being able to do that. As trauma surgeons, we have been advocates of injury prevention. We were big on seatbelts, and we're big on airbags, and we're big on looking at the things that we can have other people agree to, so that it's not red and blue. It's what are the things that most people agree to, and then let's try there first.
Well, most people agree on gun locks, don't they?
Yes.
So,
Well,
Well,
I don't know.
I don't know about that.
The reason I say
And
that
on the political spectrum, yes.
Yeah.
Individuals, no, because they don't want it. They think they need to get to them quickly.
correct. Yeah. So I think the participants that enroll in Life Outside of Violence, for that very reason, they need them under the pillow at their bedside for safety reasons. So I think that's the conversation that needs to continue to occur: is how do we make people feel safe to limit access to firearms as much. And I think also to Dr. Schuerer's point is we really need to look at this as a public health epidemic and crisis. And I think that conversation is occurring and more people are looking at it that way, but it's the same as like motor vehicle safety or smoking. You know, it's the same concept. Gun violence is a public health crisis and issue, and so we should treat it and can treat it the same as we do these other diseases, essentially.
And Darren, you spoke eloquently about the importance of male role models and so forth, but what do you say to a kid that says, you know, I mean, they're hearing gunshots at night, and their reaction is, I still got to have, you know, my weapon. I mean, how can you reconcile the fact that people living in a real world feels the need to have self-defense?
Right. So you got to look at it. If this was a gun, I can sit this gun here. It ain't going to bother nobody. But the moment I pick it up, it still won't bother nobody. The mindset. So I always say through the board of education, we have to educate them about what's going on. My effect is, I'm 52. I'm still hurting from 1989. So if I tell a kid, you're going to feel this pain for 30, 40 years, the bullets that hit me versus the bullets that hit them. Mine went straight through. They've taken off limbs. So they have to really think, if that's what you want to do, be educated on it. I always say, like a police officer, you have to show him and train him. Military guys go weeks and weeks and weeks training camps to shoot an AR. 14-year-old is nowhere in the world you can shoot an AR. You're not even strong enough. So forget your target. What about the baby 10 blocks down the street? So that's where I come in, and I go inside the schools and try to just grab many as I can. And it's like, I go up to Yateman School, and I see the hurt. I actually can see a kid trying to get out. I never forget a kid say, what do you want for Christmas? I just want to move. So now you have to say, you have to go to school, you have to get educated, then you can move. If your mother made mistakes, you making D's and F's, then you're going to be in that same neighborhood. So everybody's trying to get out, but until everybody sit at the table, we can change St. Louis.
Now, in your case, if you don't mind me asking, were you shot 13 times In one incident?
No, 4 different incidents.
4 different incidents.
Right. So that's what made me, because that's what made me want to join Kateri then, because the first time I got shot in August 2nd, 1989, nobody talked to me. They released me from the hospital, but that anger was still there. That man hurt me. So what did I do? I went out and tried to hurt him back. The next summer, I'm back in it again. Nobody came and talked to me. I'm back at it again. Back at it again, 4 different times. I was actually trying to escape, actually, everybody. How do I escape this? But I'm still surrounded by it. So I had to start reading, start educating myself on, I can go to jail for life. So I just wanted to escape. And just what happened when Kateri met me, she called me on. I was part of a team with Cure Violence. And I wanted to be hands-on. I didn't want to be waiting. I want to go before it happened. How do I talk to this kid before you get shot? So my conversation is by saying, like the little guy over there, how do I talk to him about you will get shot by the summer? You have to be around different people that got different goals. So if you're on the block, that's what happens on the block. You know, the neighborhood, I always tell people, ghetto is a group of people living. Suburbs is a group of people living. Where do they mess up where everybody got to get shot? So we got to start thinking of how do we change a kid?
That's interesting, because I don't think most people think that a gunshot victim is someone, if that person survives, likely to pick up a firearm and get revenge or use that firearm. Now, women aren't doing that. I mean, girls, this is a boy problem, right? Girls are getting shot, but they're not picking up firearms, right?
No.
Largely.
No, they're not picking up guns, but they're the big problem of it. Because you know how the cell phones, let's say like somebody get fight at a school and they videotape it. You might lose, I saw guys lose, shake hands, but when you see that fight on tape, it brings a different type of anger. Or it's sometimes girls call, he's over here.
Like you mean social media.
Yeah,
right.
social media.
I would say that it is a girl problem as well.
He didn't speak for me. No,
No, but the
Yeah.
vast majority of
Don't talk
homicides
about
are committed by men.
Yeah.
So homicide, but shootings not necessarily. And a lot of it is like premeditated conflicts with partners. And so we have several young women that are victims and perpetrators of violence because of these dynamics. And we are in a culture where there is retaliation and risk of its retaliation. Like, this is very real.
Revenge.
And we
And
are
it's
seeing
like-
more women be shot, too. I mean, those
Yeah.
numbers have gone up.
Victims.
Victims.
Yeah.
Right. Whether they were part of the instigating, we obviously don't know.
But let's take someone who is just a victim and isn't going to pick up that gun. Does life outside of violence still work with that person in ways differently, perhaps, than your important message about not perpetuating it? Do you get involved also with people who just aren't going to pick up a gun but still need your help?
Absolutely. Yeah. And so, unfortunately, we do have our program enrolls those that have been hurt and seen at one of our partner hospitals. But any contact that is made, we are connecting them either if it's our program or any other, because there's a large network in the St. Louis region, and I think it's like the best kept secret right now. But so, yeah, they're connected to whatever they may need.
So life outside of violence is started in St. Louis, the first organization of its kind in the country. We're the
Citywide. First citywide.
Okay. And yet things are not going well. We had 200 homicides in the city last year. And we said at the beginning of the show, 26 kids died from gunfire, most of them in the city. Doctor, you're from Pittsburgh. Pittsburgh actually has a higher population, 310,000 people. And last year they had about a third of the homicides of St. Louis City. They had 70 in the city of Pittsburgh. We had 200. What's going on here?
There's a lot of factors, and I am not a social worker or a social person looking at all those, but clearly we have an easier availability of guns in this area, and probably some other differences with longer-standing socioeconomic factors in certain neighborhoods. Probably those are the biggest things, but there's just a lot of differences between the two overall. But when you ask, what are we doing? I think we are making a difference with Life Outside of Violence, but it's really is one person at a time. And how important is, I know he was shot 4 separate times. We know that every time you get shot, you have a higher risk of dying. It's just like getting recurrent cancer. You're more likely to die from that cancer. You get shot again, your odds of getting shot or dying go up each time. So if we can get them at the first time, we have a much better chance of preventing that cycle, even if they aren't someone who's an aggressive person, someone who was shot. If we can get them from being shot again, we know we can save them more lives. Over time, we expect to work, right? Once you find a cure for cancer, it takes a while for it to filter through the population. This is going to take a little while from this side. But we're going to need things from the other side, too. We need to do something about how many people have access to guns right now. That's what we need to do to help on the other side.
Let's talk about, you saw how quickly I'm to cut him loose. You know, we don't have a lot of loyalty. But let's talk about Life Outside of Violence. If someone in our Channel 9 listening audience 9 PBS audience wants to get involved and help, either as a participant or, I don't know, you're obviously affiliated with the hospital, but what can people do either with their time or their pocketbook to help Life Outside of Violence?
Thank you for asking that. We operate 24/7. So we have a 24/7 line, which I can either share now or if you want to.
Why not?
Go right ahead.
Okay, so it's 314-327-6697 or Project Love at worcester.edu. So anybody can contact us 24/7, and even if we couldn't serve them from our eligibility criteria, we would connect them. So, yeah, 100% available.
Well, Mr. Seals, one student you talked to, when asked, what do you want for Christmas, said, I want to move. That's actually a pretty logical idea, is it not?
It's an ideal, but you have to put the work in. So I always tell people this story. I flunked my freshman year and my sophomore year. You only got 4 years of high school. Once my mom took me out of city school, she took me out to Oakville Senior High School. Whole different world. I graduated on time. So I'm not a dummy. So I have to show these kids, you're not a dummy. Just shoot for it. But it's kind of hard to imagine you walking outside and you seeing your father's brains blew out. You gotta look at a little kid, he want revenge. But he want revenge from nobody he know. So this guy, whoever killed this guy's father, he's going to penitentiary. But that kid, nobody comes and talks to that kid about what's going on with you. Right. It never. So we gotta look at that storm. And then that storm comes with another storm. And then once it blow over, and it's too late. So I try to tell every kid, you just gotta fight for it. I tell St. Louis all the time, I wake up 2, 3, 4 o'clock in the morning hearing the gunshots, but I always say, man, that's my fault. Or when I go to the hospital and they say he passed away, I'm like, man, that's my fault. Or like we sitting at this table right now, somebody is dying right now, somebody gets shot, I'm gonna look at it, that's my fault. Because I shouldn't have been involved in it back in the 80s. So the story continues. So what I did back in 1989, 1991, the stories are still there because it was before my time. My role models was gangsters. I didn't look at my father's role model. My father was an architect, designed planes. Why did I want to look at a gangster? Because I was surrounded. So when you walk out the house, you be surrounded, you become what you see.
If I had to pick one, without necessarily naming names, give us an example of what success looks like. Give us an example of something that you can talk about, someone who embodies the best of what outcomes you would like.
I got a kid that came to me and he said that he wanted to hurt his father. And he's in Mizzou right now. And like I tell Kateri, I'm never off. I'm always going. So I actually can take a kid that was premeditating trying to hurt someone, not just someone, his father, all because of the hurt. So everything she trained me, I come back and give it to them. So when I was with Cure Violence, everything they trained me, I give it to them. Just like sitting at this table, I'm sitting at the table with successful men. The man who I'm trying to prevent. So I have to really get to know him one-on-one basis. So every story that he got, I translate it and send it to the young men. So if he was to tell me I saw a young man lose his life and oh my God, you got to show that kid that could have been you. Mm. And you keep telling them, you keep telling them, you keep telling them. So you reprogram them. And then you peek them out. My whole vision was to send them to different places, try to regroup.
We only have about a minute to go, but are there enough Darren SEALs to have the one-on-one connection with the kids who are at risk here in our area? Do we have enough of you going out there and making one-on-one connections?
Obviously not yet. I'll let Kateri have the last word, but that's one of the reasons why we have a lot of caseworkers and a lot of case managers, and I think we're learning and getting those resources for all of those people.
Yeah.
30 seconds ago.
Yeah, never enough. But we do have enough infrastructure that is being built. And I think another success piece is we can see those that have enrolled in a program like this. We know what their repeat injury or their fatality rates look like compared to those that did not enroll that were eligible.
Well, thanks for fighting the good fight.
I was just going to say, I don't
Appreciate
speak for
it.
our audience much, but thank you.
Thank you so much.
I'm sure a lot of
Thank you so
people
much.
out there are thinking the same thing.
Kateri, Chapman-Kramer, Darren Seals, Doug Schuerer, thank you so much for joining us.
Thank you so much.
Thanks, everybody. See you next week.
Donnybrook is made possible by the support of the Betsy and Thomas Patterson Foundation and the members of 9PBS.